webcast is now starting. All attendees are in listen-only mode.
Hi, good morning. Today's Tuesday, January 26th. I'm Donna Will, Professional Development Coordinator for the Developmental Disabilities Administration. We welcome you to the Self-Directed Person-Centered Plan Process Rates and COLA for coordinators of community services and providers. We have a lot of presenters for today. We have regional directors from Central. We have Nick Burton. From Western, we have Kathy Marshall. From Eastern, we have Kim Gescheidel. From Southern, we have Onesta Duke. And also we have the Deputy Linda Yale from Western. We also have self-directed leads. We have Ola Atuyalo from Central, Tia Henry from Southern, Tina Swink from Western, and Jonna Hitch from Eastern Shore. We also have Dr. Yamonja Smalls, the Director of Coordination of Community Services for DDA. Before we begin, and also we have Mary Ann Kane-Bresci, Director of Family Supports. All participants are in listen-only mode. There are two options to hear the webinar, by computer and phone. And if you look at the panel interface on your right labeled audio, you can click either computer or phone to switch for the best option. There is a handout for the webinar, and you can find it in the handout section in the panel to your right, and it can be emailed upon request. We will be recording the webinar and posting it on the DDA website. Questions can be typed in the question or chat box in the webinar panel, and we will answer those towards the end of the presentation. So I think now I'm going to introduce Dr. Yamonja Smalls. Or Nick, excuse me, I'm introducing Nick Burton. I am so sorry.
No problem. It's Tuesday morning. All right. So welcome to today's webinar, which is focused on self-directed person-centered planning. This webinar is going to contain many of the components of our November 6th PCP webinar. However, today we will solely focus on individuals who are self-directing their services. As Deputy Secretary Simons has said, the DDA is committed to the success and growth of the SDS service model. The SDS model is an active reflection of the DDA's person-centered planning values and process that ensures each person is in the driver's seat as they plan for their good life. During this training and after, the DDA will continue to ensure you, our CCS partners, have what you need to successfully facilitate robust PCPs with each individual you support. The regions also stand by ready to collaborate and continue to move forward hand in hand with our transformation goals, ensuring a more person-driven system. Next slide, please. So for our agenda today, we are going to speak about the introduction essentially to what self-direction is and an overview of self-direction. We're going to discuss the pre-planning process of the PCP, the development process of the PCP, the approval process of the PCP, the authorization process of the PCP, and remember, this is all geared towards individuals who are self-directing their services. We know that there will be questions, and so we have a specific time set aside at the end of the presentation for questions. Next, we're going to start with Mary Ann, who's going to go over the good life. Mary Ann?
Good morning, Nick. Good morning, everyone. Welcome. As Nick stated in his welcoming remarks, the DDA is committed to supporting the person and their families in self-directing their services. We can't reiterate or reinforce enough that the person is in the driver's seat in the development of their vision and the trajectory of their life. In addition, we believe that everyone has the right to live, love, work, play, and pursue their aspirations in their community, and that people lead whole lives made up specific, connected, and integrated life domains that are essential to a good quality of life, which include relationships, a sense of purpose, health and safety and well-being, employment, and living in the community. People truly are at the center of planning a vision for their personally defined good life, which of course is done through the person-centered planning process. Person-centered planning begins with who the person is and those things that are important to them and for them. And as a result, what do and don't they want in their lives? And the goals are related to those things. The person-centered planning process requires that the person and their team work together to identify and or develop the resources, supports, and services that will support the person to live their good life. And all of this is done, of course, knowing that people's needs and wants are met through a variety of resources, such as beginning with their own strengths and assets and relationships with families and friends and acquaintances, the use of technology and the role that might play in their life, the community, as well as eligibility-specific services such as DDA in order to live their good life. Next slide, please.
What is self-direction? Self-direction, sometimes called consumer direction or participant direction, gives people the freedom to choose the services and supports they need to live independently in their community of their choosing. The core functions of self-direction are choice and control over how a person's services are provided, who is being paid to provide those services, and how much they are being paid using the usual and customary rates established by DDA. Next slide, please. Service delivery models. When a person is enrolled in a DDA waiver, they are offered the choice to have their services provided under the traditional service delivery model, meaning services from DDA certified or licensed community providers, or choose to direct their own services within the self-direction services delivery model. Under the service-directed services delivery model, the person has budget and employer authority. Next slide, please. Roles and responsibilities in self-direction. When a person chooses to self-direct their services, they have some key responsibilities. Employer authority, the person has the responsibility to recruit, hire, train, and supervise your chosen staff or providers. We also have the budget authority. The CCS will work with the participant to develop and manage their budget, which includes how much they want to pay providers within the DDA reasonable and customary rate. Additionally, individuals who are self-directing their services collaborate with their CCS and chosen team to develop and implement their person-centered plan. It is important to remind and provide guidance and support regarding a participant role and responsibility when it comes to employer/budget authority and person-centered plan development. Thank you.
Next slide, please. Oh, I'm sorry, we're where we are. Let's talk about the roles and responsibilities of the family in self-direction. The participant's family, chosen friends, and other selected team members are responsible for providing the participant with valued support towards the development of their vision for a good life. The family may assist the person in finding and utilizing natural community resources, but also to find employees and providers to address their needs. The chosen family and selected friends may help the person to discover and explore new community and employment opportunities to help ensure that the person has options that they may choose from to ensure that they have meaningful life, not a service-directed life. Next slide, please. While you, as the coordinator of community services, have many responsibilities, Your key role is to assist and support the person in finding resources in their community to help the person live their good life. You are the lead supporter, responsible in assisting the person in developing their PCP. Remember, this is one of the most important documents that you are responsible for. It should tell the person's story, detailing their needs and wants, and what is ultimately important to and for that person. It is crucial that you spend quality time developing the PCP. You are also responsible for supporting the person in completing their self-directed budget sheet. Again, user-friendly guidance will be provided to assist you with this responsibility. Next slide, please. While not required, the person may choose to hire a support broker to coach and mentor the person in their role as the employer. They should not be functioning as the CCS. The support broker coaches and mentors the participant in their role as an employer with strategies to find, hire, and manage staff, to advertise, interview, schedule, train, evaluate, and handle employee concerns, and to help determine if staff are providing services as intended. During the COVID-19 pandemic, support brokers may, in some cases, share additional roles. For example, they may function as a personal support staff. It's important to remember that the rates for these services are different and must be carefully documented when submitting timesheets. Soon, the participant will be able to search for and discover support brokers by going to the DDA website and search the list by region and county. This list has been updated with support brokers' contact information and will be made available on the DDA website by the end of January. The CCS can assist the participant in finding a support broker if this resource is needed. Next slide, please.
Okay, so roles and responsibilities and self-direction regarding the fiscal management services. So as you're aware, the participant must choose between two current financial management service providers who are responsible for supporting many of their employer-related duties, such as withholding and filing federal, state, local, and unemployment taxes, purchasing workers' compensation and other necessary insurance coverage, collecting and processing timesheets, calculating and processing employee benefits such as sick or vacation time, and issuing payroll checks and tax documents. The FMS maintains communication with the DDA regarding the authorized PCP and approved SDS budget. Employee timesheets are submitted directly to the FMS, and the FMS provides the participants with monthly budget statements. The CCS should review these statements to determine whether the person is managing their budget appropriately. Next slide. So roles and responsibilities and self-direction specific to the January 21 COLA. So on December 17th, 2020, Governor Hogan announced that he was accelerating the July 2021 provider rate increases to January 1st, 2021. The FMS and DDA will coordinate on releasing communication and guidance to participants, which will be sent the first week in February. The COLA will be effective back to January 1st, 2021. The budget reflecting the accelerated July 21 COLA will be used until an annual or revised PCP is developed in LTSS Maryland, which per the SDS memo on December 31st, 2020 will be occurring over the next 6 months. A dedicated FMS form will be used to allocate the new January 2021 budget allocation. The CCS should support the person with completing the form and requested information. Next slide. So in regards to future self-directed budgets, per the December 31st, 2020 guidance, the DDA is working to ensure all participants using self-directed services have a holistic, quality, and detailed PCP in LTSS Maryland, ensuring the detailed service authorization reflects the identified services needs per the PCP. It's also important as it relates to establishing and updating the self-directed budget allocation, which will now be based on LTSS Maryland service rates. As rates change due to rate studies, COLAs, or other means approved by the Maryland legislature, the DDA updates the service rates in LTSS Maryland. These new rates are used to calculate the person's allocated budget to direct their services as determined by their PCP. The required use of the LTSS Maryland PCP detailed service authorization for participants enrolled in either the self-directed services or traditional service delivery model ensures fair and equitable funding regardless of the service model chosen. Next slide. As noted in our recent guidance, beginning January 1st, 2021 through June 30th, 2021, all self-directed plans will be reviewed and approved in LTSS Maryland. The regional offices will be monitoring and tracking this process to ensure completion by June 30th. Similarly to the recent successful implementation of personal support, supported living billing in LTSS, the regions will work closely with the CCS agencies and participants to ensure applicable timelines are met, which have been outlined above. For future self-directed budgets, the review and PCP revisions will ensure current services and fair and equitable funding allocation based on assessed need. When the new budget allocation is established by the PCP detailed service authorization, then the person will need to create a new self-directed budget sheet. Participants will work with their CCS to update their self-directed budget sheet that will replace the January COLA budget sheet. The revised self-directed budget sheet will be submitted to the DDA for review with the PCP. The DDA will be issuing an updated self-directed budget sheet and reasonable and customary rates by the end of the month. All right, next slide. This slide is a visual representation of the information I just shared regarding reflecting the COLA and future budget allocations. The DDA is committed to reviewing and approving plans during all self-directed plans during the next 6 months. The regional office will share a PCP list with CCS agencies and recommendations on how to complete or distribute based on plan dates and quality reviews. Remember that moving forward, the PCP detailed service authorization establishes the budget allocation, which is then used to create the self-directed budget sheet that is reviewed and approved by the DDA. Again, the January COLA budget will be used until an annual or revised PCP is developed in LTSS Maryland. Once developed or revised, a new self-directed budget sheet is required based on the new detailed service authorization budget allocation. Next slide.
Roles and responsibilities with regards to the employees. CCS should support the participant in choosing their employees carefully. Hired staff and chosen vendors are responsible for providing services as outlined in the PCP and SDS budget, maintaining any required training and certifications, and submitting information for criminal background checks as required. A participant enrolled in the self-directed services delivery model may use a legal guardian or relative who is not a spouse to provide services as noted in the DDA waivers. Next slide, please. The DDA is directly responsible for reviewing the submitted PCP and self-directed services budget sheet, which, upon approval, establishes the person's total allocated budget amount for their chosen authorized services. DDA submits both the approved PCP and SDS budget sheet to the FMS before services become effective. DDA maintains communication with the CCS, the participant, and the FMS to ensure program compliance. Next slide, please.
Each regional office has an advocacy specialist who can assist in advocating for individual rights, help to address violations, and guide individuals to appropriate resources. Everyone needs help sometimes. If the individual feels that their rights are not respected or they feel unsafe, it is very important that they let someone they trust know right away. It is important to communicate to the individuals that you support that who they talk to is entirely up to them, whether it's family or legal guardian, the coordinator, the support broker, or someone else on their team. They can also contact DDA for assistance. Next slide, please. Again, within the self-directed services delivery model, the individual has both employer authority and budget authority. With employer authority, they make all decisions in the recruitment, hiring, training, and supervision of staff chosen to deliver services. As the employer of record, the individual is also responsible for ensuring that timesheets are turned into the FMS correctly and on time. You, the CCS, and the support broker, if hired, can assist with this. Budget authority means that the participant can decide what they will pay their chosen staff to deliver services within the established reasonable and customary rates. It is the team's responsibility to submit the budget and manage to be sure the participant stays within the amount allocated. Next slide, please. Today, we will review the overall plan and budget development process, which will result in the person-centered plan authorization and implementation. The goal here is to help the individual to better understand and move along their path towards self-directing services to help the person live their good life in their chosen community. Next slide, please.
Okay, so we're going to talk about pre-planning and pre-planning as it relates to the self-directed person-centered planning process, including the development of the budget. Next slide. All right, so what is the purpose of the PCP? So whether an individual is receiving their services through DDA's traditional service model or self-directed service model, the DDA believes that people are in the driver's seat when it comes to their life, their PCP, and making choices. This value is a major tenet of the self-directed service model, which gives people budget and employer authority as it relates to their needed services. Next slide. Why is pre-planning so important? Well, pre-planning is critical to developing a robust PCP, which serves as a blueprint for how the person would like to receive their supports and services in pursuit of their good life. This blueprint is the basis for the SDS budget. You may often hear that a budget is a reflection of values. Similarly, a person's PCP or blueprint is the framework for the person's budget, which ultimately is a reflection of their needs and values related to their chosen good life. In self-direction, collaboration during pre-planning and beyond is so important, given all the different players, including employees, vendors, support brokers, FMS, etc. All of these people are available to support the person in creating the blueprint for their good life. As people in the self-directed service model are creating their blueprint for the good life, it is vitally important to ensure there is trust among all the players to ensure the person is getting the information and support they need to make choices about their life. Pre-planning brings together people that are new to the person's life and those that have been around for a while. Families, friends, long-term employers bring a history to the table that helps ensure a continuity of care as the person creates their blueprint from year to year. Next slide. What is important to me and what is important for me are two important questions that we ask ourselves either consciously or unconsciously on a daily basis. When a person is developing their PCP, these questions often come up as people begin to think about, what do I want for my life? What are my aspirations? Where do I want to be in the next year? What do I need to be successful? What do I need to be healthy? And what do I need to be safe? Sometimes the answer to these questions come easily. Other times it takes thinking and planning. These questions are critically important for people and those close to them as they begin to ponder development of the person's PCP. The answer to these questions often translates to support needs, goals, action plans, and begins to transform a person's PCP document into an active and living blueprint. Next slide. We all have a support system in our life, whether it's family, friends, or others that we trust and choose to let into our lives. People who choose to self-direct their DDA services choose their employees, vendors, and if they want, a support broker. All of these people and roles add value to the pre-planning process. Each person or role brings a perspective to the table about the person that allows them to make choices about their life, including identifying needs, developing goals, and choosing when and how they receive their supports. As mentioned earlier, trust, collaboration, and continuity of care are vital to the pre-planning process. It is important to encourage the person to include those people, those roles, and voices that they trust and want to hear from in order to create a robust, informed blueprint for their good life. Of course, the person is the driver and can choose who they want at the table as they're developing their plan. Once the plan is complete, the person can share the pertinent information to their employees or vendors to ensure their needs are met. Next slide. We've talked about the purpose of pre-planning and why it's important. Now let's discuss when and how you start pre-planning. CCS are an important component of the process by initiating pre-planning no more than 90 days prior to the annual PCP. Remember, during the next 6 months, as we work together to update SDS PCPs and budgets utilizing the detailed service authorization, it will be critical to ensure pre-planning is happening prior to an individual's annual PCP or prior to the applicable quarterly monitoring event that will occur between now and June 30th, 2021, to ensure all PCPs and budgets are updated by July 1st per the DDA's SDS memo issued on 12/31/20. To initiate the pre-planning process, the CCS should be coordinating with the person to determine who they want to include in the pre-planning and identifying a date and time to have a pre-planning meeting. At that meeting, the CCS should work with the person to facilitate a conversation regarding the previous year's PCP, talking about what went well, what needs to be continued, what has changed, but also focusing on what's currently important for the person, what their current needs are, and what the goals and outcomes they have for themselves and over the next year. The DDA encourages use of the life course tools, which Mary Ann discussed earlier. Good pre-planning is the basis for drafting a robust PCP draft and budget that is reflective of the person's needs. Prior to the pre-planning meeting ending, do not forget to schedule the annual PCP meeting. Next slide.
Next slide, please. Next slide, please. Thank you. So the next part is actually the development of the PCP. It's important to understand that this is a roadmap for the next year, leading an individual towards their good life. So the CCS, in collaboration with the rest of the team, will look at the participants' outcomes, their identified risk, rights restrictions, needs, and they will help them to develop service requests that meet their health and safety and help them to achieve their good life. Next slide, please. The outcome section is where the person develops their goals. And these are the goals that they have developed on the individual's perspective, and they are good for the next year. The team should not only provide the needed supports that the individual needs, but help to identify other natural supports in the community that the individual can link to and rely on. The outcomes are associated with each authorized service, and they are all used to support a good life. This should be a holistic life, not a service life. And the outcomes should really address what the person wants to happen as a result of the supports. It should address areas such as their relationships, their job, gaining and holding status in their community. Next slide, please. The services need to be considered and outlined in the detailed service authorization section of the PCP. They will talk about the other resources available in the community, natural supports, and they will talk about how the assessed need is met. The duplication of services from doors, the school system, natural supports also will be looked at whenever you're developing your services that are needed. You need to look at your services on a month-to-month basis and make sure that you're looking at what is needed, because the service authorization area really approves services a month at a time. The documentation needing to justify these services, such as a behavior plan, the HRST, any other documentation that might assist in verifying the need, should also be included and uploaded into the documentation section of this PCP at this time. Next slide. So under the traditional model, individuals are choosing a provider to deliver their service. And the service authorization in LTSS Maryland then has to be sent to the provider for them to accept the service and send it back an approval for the PCP. The participants that are self-directing their services can hire DDA providers to develop some of these services for them, but they will not be adding those in the detailed service authorization. So the service would be in there, but it would not be linked to a provider because all payments for self-directed services are through the FMS. Next slide, please. So under the self-directed delivery model, individuals and vendors, including DDA providers, are hired by the participant, self-directing, and are not included in the service authorization section. So the services are reflected, but the provider is not linked to that because all of these services are billed via the FMS entities and not through LTSS Maryland or PCIS2. If selected by the participant, DDA licensed or certified providers should complete the detailed service authorization tool and return that to the CCS so that it can assist the team in adding the units to the detailed service authorization in LTSS. The service authorization section should capture all of the required information, including the services, the frequency, the scope, and duration, with the exception of the provider. Next slide, please. The PCP and supporting documentation needs to demonstrate the need and the assessed need for the service that is requested. So the questions that need to be asked is, what is the need or the risk if the service was not provided? How is other resources being explored? And then how will this service meet that need or mitigate that risk? Assessed need can be demonstrated with documentation such as a participant schedule, risk and mitigation strategies, the health risk screening tool, a nursing care plan, a behavior plan. It also can be described in our focus areas, what's working, what's not working. Next slide, please. To assist with determining the unmet needs, the participant should include should be supported in developing a holistic full schedule. So the schedule that's included with the PCP should really show what the natural supports are doing, what the educational system is doing, what REM or Community First Choice or other Medicaid providers are doing, as well as what services are requested by DDA. And what this would look like in a typical week to help demonstrate the individual's need. It's important to consider if this changes throughout the year. Are there different services needs during school or during the summer? Are there winter breaks, spring breaks? Or does a person's needs change based on the weather? Does somebody not go out in the heat and needs to do more indoor activities during that time? Next slide, please. The DDA will provide specific training on completing the self-directed budget sheet. The self-directed budget sheet must be submitted with the PCP. The participant, with the support of their CCS, creates their self-directed budget sheet. And this is based on their PCP detailed service authorization request. That helps them develop the anticipated budget from the service cost tool, or from the detailed service authorization, gives the generalized cost that they can then use towards their budget. Self-directed sheet must mirror the services and the units that are included in the detailed service authorization. The total cost shall not exceed what's in the anticipated budget of the detailed service authorization. Participants can set their own wages in the self-directed budget sheet, and that's based on the reasonable and customary standards. Please note that the self-directed budget sheet for the initial PCP and the annual PCP cannot contain individual and family-directed goods and services, except for staff recruitment and advertisement. Next slide, please. The participant sets wages in the self-directed budget sheet based on the reasonable and customary rates. That form will come out again by the end of January, as discussed earlier. The participant's self-directed budget will be uploaded in the documentation section of the PCP. Upon receipt of the PCP, the regional office will review the self-directed budget sheet, and this will be reviewed along with the detailed service authorization. Any changes that are requested on the detailed service authorization then may require a new budget sheet. Any questions regarding the self-directed budget sheet can be sent using the PCP clarification request. Once approved by the regional office, a letter will be sent to the Fiscal Management Service and the agency will approve the budget. Next slide, please. It's very important to project out the effective date. When the plan is submitted to the regional office has 20 business days to review and process the PCP. If there are clarifications, sometimes that can make the process a little longer, so you want to make sure that you project out the start date, the effective date, so that we can approve the plan and then get it to the FMS so that everybody can get paid in a timely manner. If a person's moving from traditional services into self-directed services, the traditional services would end at midnight the night before the self-directed services start on the next day. Next slide, please. This is simply a list of additional resources and some links to forms that also need to be included, such as the family of staff form and the support broker agreement form. So this is just all in one place for you to click on those links so that you have the access to those things. Next slide, please.
Good morning. Now I will share information regarding the approval process for self-directed person-centered plans and budgets. Next slide, please. The PCP approval process includes participants and their legally authorized representatives' approval and the CCS's approval. Based on information shared during the person-centered planning process, the CCS is responsible for developing the PCP in the LTSS Maryland system and for sharing the finished product with the participant and or their legally authorized representatives for their review and approval. Next slide, please. The CCS's responsibilities with regard to the PCP are as follows. The CCS will review the draft PCP, which includes the proposed services, scope, and frequency with the participant and their legally authorized representatives, if applicable. The CCS will also ensure that the services noted in the DSA section of the PCP adhere to our waiver requirements as noted in the current approved waivers and the guidelines for service authorization and provider billing documentation. The CCS will upload all documentation to substantiate an assessed need to the documentation section of the PCP. For example, if an assistive technology need exceeds $1,000, the CCS will ensure that an assistive technology assessment is provided and uploaded into the documentation section of the PCP. The CCS will ensure that the HRST is completed and a clinical review is obtained for people that have a healthcare level of a 3 or higher. Once approved by the participant, the CCS facilitates the participant's agreement on the participant signature page and uploads it into the PCP signature section. Next slide, please. The CCS will review the SDS budget sheet with the participant and their legally authorized representative, ensuring the following. The budget aligns with the services in the DSA and that the rates adhere to the DDA's reasonable and customary standards. The effective start and end dates on the budget sheet correspond to the effective date noted in the PCP. Legally mandated earned sick and safe leave benefits are noted in the budget sheet for Montgomery County residents. Support broker services are accurately reflected with the appropriate hours and rates if applicable. Next slide, please. With regards to individual and family directed goods and services, the CCS will ensure that those services are purchased from savings identified and available in the participant's annual budget. The goods and services must fit within the participant's budget without compromising the participant's health and safety. Except for $500 per year for costs associated with recruitment of staff, the DDA will not authorize additional funding for individual and family directed goods and services in the participant's annual budget. The CCS will also ensure that all vendors or providers are listed accurately and the taxes are not accounted for within the budget sheet for services provided by a vendor or provider. If approved by the participant and their legally authorized representative, the CCS will upload the budget sheet into the documentation section of the PCP. Next slide, please. The CCS's responsibilities with regard to the Waiver Services Agreement Form. The Waiver Services Agreement Form is an agreement between the Maryland Department of Health, DDA, and participants within the self-directed service delivery model to receive specific DDA services and supports. Once the Waiver Services Agreement Form is signed, the CCS will upload it into the documentation section of the PCP. The CCS reviews the final PCP with the participant prior to submitting to the DDA. And once approved by the participant, the CCS facilitates the participant's agreement on the participant signature page and uploads it into the PCP signature section. Next slide, please. Coordinators of Community Services, or CCS, approval is also required for the PCP. The CCS will conduct a final review of the plan to ensure that it meets all DDA requirements. The CCS indicates their agreement to the PCP by completing the Coordinators of Community Services signature page and uploading it into the PCP signature section. Once finalized, the CCS then submits the PCP along with the SDS budget sheet, waiver agreement form, and all other necessary documentation via the LTSS Maryland system to the regional office for review and authorization. Annual plans must be submitted no later than 20 days prior to the PCP annual plan date. An initial and revised plans should be submitted within 10 business days or less after the participants or their legal authorized representative's approval. Next slide, please. Under the self-directed services delivery model, DDA licensed or certified providers can be utilized as vendors. If selected by the SDS participant, DDA licensed or certified providers will provide applicable vendor forms from the person, will receive applicable vendor forms from the person's FMS agency. The provider's completion of the FMS form is their agreement to provide the services. It should be noted that this agreement is specifically between the employer of record and their chosen vendor or provider. The FMS confirms that providers meet required qualifications and facilitates the completion of any required documentation. Next slide, please.
Authorization process for self-directed person-centered plan and budgets. Next slide, please. Regional offices receive, review, request consults, request clarifications, and approve all initial, annual, or revised PCPs through LTSS Maryland. The regional offices will review PCPs within 20 business days and will use the PCP checklist to ensure all of the necessary components of the plan are completed accurately. Other essential documents and tools that will be utilized during the review process to authorize services and determine and assess need are the DDA Service Authorization Guide, the current Medicaid waivers, relevant policies, and the detailed service authorization tool. There may be others that are person specific. Next slide, please. All services noted in the detailed service authorization section of the PCP should directly relate to an assessed need, and the corresponding documentation should be uploaded by you into the PCP to substantiate the need. In its review, the regional office reviewers may request internal consultations or external clarification requests with you to support the PCP. Once the PCP meets the approval criteria, the authorization will be finalized in LTSS Maryland. An approval letter along with the approved PCP, self-direction budget sheet, and signed waiver agreement form will be disseminated to you, the FMS, and the SDS participant. Next slide, please. Important considerations for authorization. The self-direction budget sheet must include the DDA services authorized in the PCP based on the assessed need. The assessed need must be described within the PCP. Any supporting documentation to substantiate a need should be uploaded into the PCP. Participants may determine staffing and pay rates based on the reasonable and customary rate standards. The self-direction budget sheet for all PCP plan types may not contain an allocation of funding for individual and family directed goods and services, except for the staff recruitment and advertising. The self-directed budget sheet may only be submitted by the by the CCS, along with the PCP to be reviewed and approved by the regional office. As the champion for and partner with the individual, you play a critical role in helping them reach their good life. Your efforts and due diligence in effectively working through the pre-planning and plan development will improve the timeliness, effectiveness, and likelihood that the PCP will be approved and authorized. The assessed need is critical, and Medicaid will not pay for services that do not relate to an assessed need. To assist SDS participants, the DDA has developed the reasonable and customary rate standards as a guide to identify what rates the DDA would approve as meeting the reasonable and customary requirement. This guide can be found on the DDA website under Self-Directed Services Forums. An updated guide is expected at the end of the month, as noted in the Deputy Secretary's webinar on January 22nd. Next slide, please. And here we have included a list of helpful resources. Next slide, please.
So this is just in case you are wondering who is who. You heard Nick talk. You also know that there is regional directors in each region. So we have Kim Gashado in the Eastern Shore, Onesta in the Southern, and Kathy Marshall in the Western. The next slide gives you, next slide, please. The next slide gives you all the self-direction leads who you heard from today, Ola, Jana, Tia, and Tina. So this is our resources. And so we really ask that if you have any specific questions to people that you're supporting or specific cases that you may have troubles with, to contact these people directly. I'm going to turn it over to Dr. Smoss for some questions.
Thank you so much, team, for that presentation. We have quite a few questions that we will use this time to attempt to get through. However, if we are unable to cover all of the questions you've submitted, don't worry, we will answer them, and they will be uploaded in a frequently asked questions document to the DDA website. Okay, so the first question I'm going to launch to Tina. The question is, how do I get approved for self-directed person-centered services? My child is currently being serviced from a provider agency.
So the first place to really start is to have the conversation with your CCS about how you would like to change to the self-directed model. The CCS is then responsible to work with you through this process, and that could be changing at the time that your annual meeting is held, or if you're in mid-plan year, it may require revising your PCP to address this transition. But the CCS is really critical in working with you through this process and identifying if your needs are changing, what service requests you have, what community resources are available to help you meet that need, and helping you develop a self-directed plan that will address your needs as we have gone through this presentation and described that. But the CCS should be working with you, and if they have questions as they go through the process, can either speak to a supervisor within their own organization, or if need be, if it's a unique situation, of course, reach out to the regional self-directed lead.
Thanks, Tina. I'm going to stick with you here. Next question, is the CCS also required to assist the person and the family for finding vendor for services that the participant is self-directing, for example, getting that HRST completed?
So yes, the CCS should help to find a vendor for those such services. Certainly, the regional office tries to provide information in regard to nursing support services and nurses that may be available to help in that particular type of situation. They should provide information to the team as to the resource options, but providing a wide variety, but not selecting just one person that might be able to meet that need, so as not to present a conflict of interest. And if resources are a question and what may be available, once again, reach out to your regional office self-directed lead to see what information is available, but also look at various community resources that might be available to anybody that has the same need.
Thanks, Tina. Nick, this next question is for you. What roles will this detailed service authorization tool and cost detail tool play when discussing self-directed services? Are these documents needed to put the process through?
So certainly individuals who are self-directing their services can choose to use the detailed service authorization tool with their providers. However, that's not required. They certainly can work. The detailed service authorization that needs to be completed doesn't actually identify providers on it, but it is the way to allocate that budget. And some find the tool helpful and can certainly work with their vendors to utilize that tool. But as you know, the services for self-directed services are paid out through the FMS. And so it's important to make sure that that PCP and the budget tool are created so that the FMS can pay those services. We really use that cost detail sheet for those services that are billed and paid in PCIS 2.
Thank you, Nick. I'm going to take this question. Just to clarify, in the normal PCP process, the prep or pre-planning is supposed to occur between 120 and 90 days before the annual plan date. However, for individuals who self-direct, you are saying that the prep or pre-planning timeframe starts at 90 days. So it's really important that CCS is working with the participant and team as early as possible throughout the entire year. You're collecting information and getting updates. But it's about at the 120-day mark that the CCS should begin collecting that information. And the 90-day mark is the earliest at which the CCS can begin to enter the annual plan information in LTSS. So that 90-day mark is when you're actually entering into the system. Linda, this next question is for you. The DSAT could be completed by the provider, or should it be completed by the provider? Is this documentation required? You know, we kind of answered this question. Nick, you answered it prior, so I'm going to go to this next one. Linda, still for you. Does the DDA website have a list of community available resources in each region?
At this point, we don't have a list of community available resources on our DDA website. Your best place to go for a list of community resources is to your CCS provider. They should know the resources in your community and be able to guide you towards those.
Thanks. Tina, this one is for you. Will the support broker start signing and submitting timesheets?
No, the support broker, as the mentor or the coach, should work with the person receiving services to review the timesheet when they are completed by the staff, making sure that the hours listed on the timesheet are the hours that the staff actually worked. And they should make sure that the person signs the timesheet themselves and then assist them in submitting that timesheet to the FMS in a timely manner. The goal here is really for the support broker to really help the person become as independent as possible in completing these tasks based upon their own needs and skills. So, but certainly should be working with them through this process and empowering them to feel that they are truly the employer.
Thanks, Tina. Nick, this one's for you. Is there a plan for the person to receive status reports on where their person-centered plan is in the process, since it's the personal blueprint?
Yeah, I mean, the person that really should be, in terms of if it's at the CCS, the person should be communicating and working with their CCS. If it's in regards to at the regional office, you certainly can reach out to the regional office SDS leads. You can reach out to the regional office deputy director, directors. If you have a question about where a PCP is, you can certainly reach out and we can help you identify where that plan is in the process if it's within our office.
Nick, I'm going to keep this one with you since it aligns. What is the timeline from when DDA receives the budget to when it will be reviewed?
So when a PCP, we ask that a PCP and a budget and all of the applicable documents to be able to review and approve a PCP, including the budget document, are submitted to our office within 20 days of the APD date, and or for a revision, we ask that, again, those are submitted, and then the DDA has 20 days to be able to review those and get those approved and moved through the system so that the individual can start accessing the services and supports that they need.
Thanks, Nick. Linda, can a vendor be paid for transportation, or should that cost for driving the individual be built into the vendor fee?
So if an individual uses transport of some sort, an Uber, a taxi, a bus service, that it would be considered a vendor that can be put into their transportation. A lot of our services include transportation as part of the rate. So for personal support and for CDS, those services have transportation included in that rate. But if there's a need for independent transportation above and beyond that, where you need to pay for a bus or an Uber or something for transportation, that can be added to the budget as a transportation line.
Thanks, Linda. Tia? So we are not using the PCIS budget amount any longer to make the annual budget?
Yes, that is correct. Now that we are using the DSA section of the PCP, that is how the total budget will be determined.
Thanks, Tia. Tina, there's no drop-down option for DAHAB in the detailed service authorization of the PCP for self-direction. What's up with that?
So there's no drop down for that because you are unable to self-direct DAHAB, and what that just means is if you select that as an option, it's not going to work in LTSS because when you choose DAHAB as a provider, the provider is determining the staff that worked with you and things. So if we put that in there, it's not going to allow the plan to be approved. So for right now, I think the best option is to select other state plan services, I think it says, or other state funded services. So we have that as a placeholder and you can put the information in there so that it's included within your plan.
Tina, can you clarify how you responded to that? You said that is not a self-direction option. Can you tell us what authority the person has in self-direction for that service?
They have budget authority because you're able to work with the selected vendor to establish the rate that they're going to be paid and the number of hours that you may be attending. But what you don't have is employer authority because the vendor or the DDA provider is the one that is responsible for hiring and firing and training the staff that will work with you.
Thank you.
Okay, Nick, the next question is, since the CCS monitors the budget, will they create budget mods for the individual and submit these documents?
Well, kind of as we discussed in this training, that the CCS should be working with the individual to ensure that their PCP and their budget are a reflection of their need and also a reflection of the detailed service authorization in the PCP. So it's really a collaboration with the person to make sure that all those are reflective of the person's needs and that they're submitted to the DDA so that they can be processed.
Thanks. Linda, how is the person to bill for staffing when they are assisting the person during virtual services from the provider and both cannot bill at the same time?
So that sounds like it's a question related to the Appendix K, which is an addition to our waiver based on the state of emergency and COVID. At this point, we are allowing our day providers to provide an hour of service and therefore then be paid for 6. And at the same time, allowing individuals to have personal support staff present to assist them with logging in and participating in those activities. So both of those services can be paid at this time.
Thanks. Jana, if a participant has a set budget, but you place the services into LTSS service authorization and the cost goes over the budget, how would the CCS address this manner?
So the service authorization section is going to generate a total budget amount, and that would be the maximum amount that the self-direction participant has to create their self-direction budget. When they go to create the self-direction budget, they're going to utilize the reasonable and customary rates to come up with their staff wages, what they would pay vendors, and that sort of thing. But the overall self-direction budget would need to be at or under the total budget amount generated by the service authorization section.
Thanks, Jana. Tina, a family member would like to apply for self-directed services during the COVID pandemic in order to receive support during this time and later return back to the traditional provider model. Is this possible? How feasible is this? I'm sorry, Tia. A family member would like to apply for self-directed services during the COVID pandemic in order to receive supports during this time and later return to the traditional provider model afterwards. How feasible is this?
So the process would be submitting a revised PCP to indicate that the person desires to self-direct their services. And if that desire changes in the future, the same process would be utilized to transition back to the traditional model. But it should be noted that the decision to self-direct should be based on the needs of the person and not necessarily a convenience per se for other parts of the team.
Thanks. Ola, for individuals who have not had an approved PCP for some time, is there a push to get their plans approved quicker?
Yes, the push to have outstanding person-centered plan reviewed is ultimate for the DDA, and having those plans approved, submitted to the FMS is what we're pushing for.
Thanks. Jana, where would the individual directed goods and services be noted in the PCP if not in the DSA or budget on the budget sheet?
If we're talking about an annual or an annual PCP, the individual and family directed goods and services that could be added in would be the staff recruitment and hiring, and that should be a drop down in the service authorization, and it's also a separate line item in the self-directed budget.
Okay, there's some really great questions here, but there's some overlap, so I'm just kind of moving through these. Tia, can a family that are the individual's guardians and rep payee be staff for the person, or does being that person's rep payee stop them from being a staff for that person?
Excuse me, I'm sorry.
Tia,
I'm here. I'm sorry.
Okay, that's okay.
Per the waiver, a legal guardian that is not a spouse and a relative that's not a spouse can serve as a staff person for specific services that are detailed in Amendment 3, which include community development services, personal supports, respite, and some of the nursing support services.
Thank you. Okay, Linda, how is healthcare level 3 defined? Who conducts the clinical review?
So the HRST, which is a nursing tool, a nursing assessment that helps to identify an individual's needs and level of support, is completed by the CCS. If it scores a 3 or above, then it goes to the nurse that is assigned to the plan to review, and that is a clinical review. If it's somebody just going into service, it goes through our contract nursing service. Otherwise, there should be a nurse assigned to the plan for that clinical review.
Thank you. Tia, at what point is the budget spreadsheet submitted? Before or after the PCP and detailed service authorization is approved in LTSS?
No, the SDS budget sheet should be uploaded into the PCP and submitted when the PCP is submitted to the regional office in LTSS, Maryland.
Tina, DDA already has a lot of my son's medical documents. At this time, do we have to resubmit these docs?
I would say no, it's not necessary to resubmit documentation that has already been submitted. If you've already given that to your CCS and to DDA, I would say we already have that on record.
Thank you. Okay, so this is a little longer question. We often have to work with our CCS to make sure that the units are correct in LTSS for traditional service plans, especially in months that contain more than 4 weeks for self-directed services. Since the service provider can't see any information in LTS, what safeguards are in place to make sure that a service provider is paid correctly? And I'm sorry, I don't think I identified someone to answer. Who feels most comfortable answering that?
So Dr. Swans, let's tag team so that while you read, I'll ask the next one and vice versa. This one is going to go to Tina. Can you do traditional and self-directed services at the same time?
No, you cannot. What you can do is kind of when we were talking about using a DDA traditional provider that's either approved or certified to provide services, they do that as a vendor within your self-directed plan if you choose to use a provider or a vendor instead of an individual staff person to provide the service.
Thank you.
How can we make a budget without the established reasonable and customary rates? What can we use for guidance? I see, Patricia, you've already answered. The DDA rates posted from 2017, we'll be updating them this week. We have rates to publish for all services, and it's up to the self-directing participant to decide what they're going to pay that person. So they have an opportunity to choose exactly what they'd like to pay their staff, as long as it falls within the reasonable and customary rate ranges.
Nick, this one's for you. When is the budget tool submitted to the FMS?
So once the once the PCP and the budget are submitted to the regional office, and it's reviewed with to ensure the individual's needs are captured and everything's approved, it then is processed through the regional office and then sent up to the FMS. And remember, the DDA has that 20 days to be able to review that PCP and or that revision. And so then if, depending on the clarification request or depending on any sort of modifications that need to be made, that should be getting reviewed and approved and sent by the APD date.
Thank you.
Nick, does a hired DDA provider have to complete the DSAT tool, or is this optional for them?
So individuals that are self-directing their services can work with their vendors on if they find it helpful to complete that DSAT tool, they certainly can do that.
Nick, can you explain what does the CCS have to do to approve a budget? Do they go separately? Do I submit my person-centered plan and get it approved? Or do I have to submit the PCP and the budget together to be approved?
Yes, the latter. You should be submitting your budget with your PCP so that the region can review it in its entirety. Remember that the budget is based off of the detailed service authorization in the PCP. And the budget is a reflection of those needs and those authorized services, and is part of the entirety of the PCP and the budget that needs to be reviewed and approved. To do things in stages or separately would certainly delay the process potentially, and we want to make sure this is an efficient process as possible.
Thank you.
Okay, Jana, transportation within the rate, can the employer still reimburse their employees for mileage?
So I think Linda said before, there are certain services that transportation would be included in the rate, such as personal supports and CDS. So that transportation, if you're using a vendor, that vendor could pay their employee for the transportation reimbursement, but it is included in the rate of that service.
Tina, can you explain this a little further? I think people need to, one more clarification on the day program in the PCP. Can you explain that again and explain how a person can choose day programming in the PCP and in the system if it's not there?
Okay, so because day habilitation services are not self-directed, meaning that the person self-directing their services does not have employer authority over that, the DDA provider providing the day hab hires and trains and fires the staff and determines who is going to be working with you within that program itself. Therefore, LTSS will not allow you to choose day hab within a self-directed model PCP. So you have to choose, the CCS will have to, I believe the drop down would be a DDA state funded service. And then within that, the CCS would need to note that it's day hab and the vendor that's providing that, and provide information within the PCP as to what that service is.
Thank you, Tina.
Trisha, this one's for you. do you have Spanish-speaking interpreters that can help with the self-directed Spanish-speaking parents? Question.
That's a great question. So the DDA has an interpretive services that we can interpret all documents if we know in advance what they need to support with. We're able to actually put all the questions and answers that we're getting today in other languages by using our interpretive services. So we do have that option to do that. We just need to know in advance with information of who, what, when, and be happy to generate that in multiple languages.
Thank you. Jana, can you confirm that the start and end dates on the self-directed budget sheet should correspond with the PCP year and annual year and not the fiscal year?
That is correct. If the person is using the Arc of Central Chesapeake as their FMS, they are accepting one budget based on the person's annual plan date. So it would go from the start of their annual plan date to the day before their annual plan date of the following year. MedSource is requiring 2 budgets that split the plan year between the fiscal year. So you would go from the annual plan date to June 30th for one budget, and then a second budget from July 1 through the day before their annual plan date of the following year. But both plans are based on the individual's plan year and not the fiscal year.
So this is our last question, and it's going to go to Nick. And Nick, can you please just go back and probably add some things to this, but people want to know about COLA. And the question is, does every self-directed participant's PCP, whether annual revised, need to be updated between January 2021 and June 30th, 2021 due to COLA?
Good question. So I think there's 2 things that I want you all to be aware of in regards to the COLA. So in December, as a part of the governor's executive orders related to the COVID emergency, he authorized the July 2021 COLA to be distributed and issued in January 2021. So the DDA is doing 2 things. One, we are going to be sending out some instructions and documents and a memo regarding how to access that COLA immediately for individual self-directing services retro to January 1st, 2021. In addition to that, as we move forward between now and June 30th, 2021, yes, all self-directed service participants, PCPs, and budgets will need to be updated utilizing the detailed service authorization in the PCP. That detailed service authorization utilizes rates that have been updated in LTSS. Those updated rates in LTSS are reflective of the COLA. And so when that PCP and that budget gets updated over the next 6 months, it will be reflective of the COLA and will replace the budget modification that was completed as a result of the governor's executive orders specific to early distribution of the July 2021 COLA. So there's COLA now and COLA in the future, and kind of how that looks and what that's going to look like over the next 6 months.
Thank you, Nick. Okay, Dr. Smalls, if you're talking, you're on mute.
I got it. Thank you. So team, I first want to thank you all for the hard work that went into addressing some of the feedback received from CCSs, providers, vendors, stakeholders, and our participants, people who are self-directing, to begin the discussion around what CCSs need to support people in successfully navigating their self-directed services. This is the beginning of hopefully several trainings and the development of several tools that will be helpful to all of us. So want to just take this moment to say thank you. We do hope that you're able to reach out to us individually, your regional offices, for questions that you may have. Understand that we will be answering all of the questions submitted today in a submitted and uploaded FAQ page, and we are looking forward to getting your feedback for the additional documents that we will be submitting to you, which include the self-directed handbook, the training on how to accurately fill out and complete and submit the self-directed budget tool, and other documents that you've requested some additional supports on. Thank you so much for your time today. Continue to be safe, be kind to yourself and to each other. Looking forward to more of these trainings. Thank you so much.